Hello, my name is Lily and I'm a student nurse from Newcastle and I'm currently in my final year. Today I'm going to be talking to you about some of the common misconceptions about community nursing. A community nurse is a registered nurse who provides care and support to individuals within their own home, GP clinics, care homes and villages across the United Kingdom. Community nurses must have excellent communication and interpersonal skills, but also be extremely resourceful to meet the needs of individuals within their own homes. Community nurses offer care throughout the day and out of hours services in the evening, meaning that they cover 24/7 care. Without the help and support from community nurses, many individuals in the UK would struggle to live well at home. They play such an important role in our society, and I think sometimes they are overlooked. So I've recently been offered my first ever nursing position, and it's as a community nurse, and I'm so excited. I've always been drawn to community nurse ever since I began my career as a nurse, and this is because I was inspired by the care given to my late nana. The community nurses who provided her end-of-life care were outstanding. They were so genuine, caring, competent and so holistic with everything they did for my nana and my family. Not only did they meet the needs of my nana, but they also met the needs of me and my family and always made time if we had any questions or concerns. And without any doubt, they had a really busy schedule, but they never made us feel rushed and they always ensured that there was plenty of time to spend with my family. These community nurses who looked after my nana are still some of the best nurses I've ever come across. So I really wanted to be a community nurse so I could give this kind of care to other people. It was done right for me and my family, so I would like to provide this kind of care and support to other families in the UK. So it came as quite a shock when I started my nursing journey that there was some negative views about pursuing community nursing. It seemed lower down the hierarchy of nursing jobs, with more acute and intensive care positions being somewhere near the top and palliative and community care seemingly being somewhere near the bottom. There seemed to be a general understanding that palliative care and community nursing was somewhere where nurses go to retire, somewhere for an easier life. This is clearly not true, but I guess it must be part of the nursing culture we have within the UK. But I do believe it is changing and for the better too. So throughout this video, I'm going to present some of the common misconceptions I personally come across and kind of try and debunk some of the myths around community nursing. So during my placements, other nurses and members of staff would ask if there was any area of nursing I was interested in pursuing after I qualified. When I'd say I was interested in community nursing, most of the time I'd get quite a negative response. People would say, you should gain more experience in a hospital first. You'll be drinking cups of tea in the community mind. It's not as easy as you think. You know you'll be a lone worker, so there's no support, and it's hard to progress as a community nurse. All of these statements are 100% false. During my community nurse placement, I gained so much knowledge and experience I struggled to get on the wards. Being on your own and having to make clinical judgments really improved my management and clinical judgment skills. So now I'm going to talk to you about some of the common misconceptions about community nursing and a little bit about my own experience on my community nurse placement. Number 1, you'll be making cups of tea in the community. I don't really know where to start with this one, but I guess the mantra behind it is that people believe that community nursing is an easier life than ward-based nursing. This is kind of ridiculous because nobody comes into nursing for an easy life. The Royal College of Nursing has just staged its first ever strikes in its 106-year history. Nurses are striking across all disciplines because of increased workloads, staff burnout, high levels of staff retiring, and patient safety being compromised daily. This is the same in the community. During my own community nurse placement, I was lucky enough to be given my own caseload. And I quickly learned you had to be really good with time management and be really resourceful to ensure that you got all of your visits done in a good amount of time. Not only can community nurses be given a large caseload, They also have to find their way to their patient's address, but you also don't know what to expect once you arrive at that address. The patients may require extra assessments or extra interventions, or you may even suspect that you need support from a paramedic if they have a blood clot. And finally, making patients cups of tea is sometimes the best thing you can do in the community or ward for that patient that day. Sometimes it's the little things that you do for patients that mean a lot to them. Admittedly, it may not be a life-saving intervention, but it is patient-centred care, one of the fundamentals of nursing. Number 2, you aren't supported in the community. This is false. There is a lot of support from the multidisciplinary team in the community. You get support from healthcare assistants, other nurses, nursing associates, other student nurses, GPs, paramedics, pharmacists, specialist nurses, and out of hours teams, and there's way more. Although you may be a lone worker, community nurses definitely do work as a big team. They tend to contact each other if they need extra help or advice. So in my community nurse placement, I went to do what I thought would be a simple dressing change of where a drain had been removed. Upon arrival, I realised that the patient had a larger bandage across her chest as she had had a mastectomy, and a smaller dressing where the drain had been. So, working within my own competence and scope of practice, I decided to ring my matron to get some more advice. She was able to quickly bring up the computer system and see exactly what the patient needed that day. As the patient was going to see her specialist breast nurse in a couple of days, we both agreed it'd be best to leave the larger dressing to the specialist breast nurse, and the dressing was dry, clean and intact. I felt supported and reassured by my team. Number 3, it's hard to progress as a community nurse. Lots of nurses I've worked with on the wards have had this opinion, and I'm not really sure where it stems from. I don't know whether people think you can just be a band 5 in the community and then a band 6 district nurse, but this isn't the case. There's lots of different areas you can specialise in as a community nurse. It can be a door opener to school nursing, district nurse, and you can go on a course and become a district nurse, specialise in more complex cases in the community. You can also specialise in different areas, so you can become a tissue viability nurse, and palliative community nurse, and there's lots of different education programs you can go on, such as wound care, pressure sore management, vaccination. So there's lots of different areas you can pursue as a community nurse. And just because you start your career as a community nurse doesn't mean you can't go back into hospital nursing. Number 4, community nursing is not suitable for newly qualified nurses. I've been told this a lot as a student nurse, that community nursing isn't suitable for newly qualified because you don't have enough hospital experience. Although I do appreciate that you are a lone worker in the community, as a newly qualified nurse, either on the ward or in the community, you do have a period of shadowing more experienced nurses, where this helps build your confidence and competence as a health professional. You should also have a period of preceptorship time, where you are supported by more experienced staff and have to be signed off on clinical skills to ensure that you're competent and confident as a nurse. This is usually a structured approach for anyone starting their career in the NHS, such as nurses or nursing associates. By having this support, it helps build your own values and behaviours as a nurse and enables you to follow best practice and sets you up for a prosperous career as a nurse. Number 5, you'll de-skill as a community nurse. I think I've heard this statement the most, and I think it comes from a lack of understanding of what community nurses do day to day. A community nurse is so vital and so important in society. Community nurses carry out vaccination programs, catheter care, continence assessments, and help support those who are nearing the end of life. Therefore, meaning you have to have really good communication skills and able to provide bereavement support and empathetically listen. Alongside this, community nurses must have a strong medicines management base. And this is because you're making important decisions about someone's end-of-life care. So it simply isn't true that you'll de-skill as a community nurse. The role is complex and there's always space for more learning, and you really have to be resourceful to be a community nurse. Number 6. You'll be wasted as a community nurse. I've recently been told this after receiving the news that I got a job as a community nurse. And admittedly, I was happy that they thought I was a good nurse, but also a little offended that they thought I was choosing an easy option. If you want to work as a community nurse, then you go for it. Follow your own ambitions and plans for your career. If there's any area of practice that you're passionate about, don't listen to the views of other people. You follow your own ambitions. It's your nursing career, so you can do whatever you like with it. So to conclude this video, community nurses are such an integral part of the NHS workforce. We're currently living through an ageing population, meaning that people are living longer and developing more chronic conditions. Therefore, they need more support in living well within their own home. Furthermore, community nurses also help avoid A&E and hospital admissions, and this is because we can implement care plans and refer to other helpful services to help support that person living at home. Therefore, they won't need to go to A&E. And finally, I think it's a really exciting time to be a community nurse because in the NHS long-term plan, they have pledged funding and more focus on the role. I strongly believe that there should be more education and focus on community nursing. I think there should be more placements within student nursing degrees, therefore more people would feel supported and inspired in going into this role. I really hope you enjoyed my video on community nursing and some of the common misconceptions surrounding it. Thanks for watching.